Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Dr. Philip Chennell about hypodermic syringes and how the syringe material can affect the drug substance inside the syringe. Why don't you start by introducing yourself?
So I'm Philip Chennell. I'm a hospital pharmacist at the teaching hospital of Clermont-Ferrand, which is in France. And I'm in charge of the quality control and development laboratory in the hospital pharmacy, and also a member of the Material for Health research team at the Institut de Chimie de Clermont-Ferrand, which is the chemical institute for science in Clermont-Ferrand.
And can you give us a brief overview of your role, what your current job involves?
My hospital duties allow me to be in charge of the quality control department, in which I supervise the physical, chemical, and microbiological testings of the pharmaceutical preparations that our hospital pharmacy produces for our patients. And in my university research setting, I teach pharmaceutical science and actively investigate content container interactions.
You recently presented a short communication at the JAPAC Congress in France, in which you described the use of two different types of syringe for bevacizumab solutions for intravitreal injection. And this is what I'd like to talk about today. But first, a bit of background. What is an intravitreal injection, and when might such a procedure be required?
An intravitreal injection is a medical procedure in which a medication is directly injected into the space in the back of the eye, and that space is called the vitreous cavity. And I suppose you could say it's filled with a jelly-like fluid called the vitreous humor gel. It can be used for the treatment of a certain amount of retinal pathologies or illnesses, like, for example, age-related macular degeneration, choroidal neurovascular membrane, or macular edema, or also for the treatment of endophthalmitis.
So, what's the problem here? Isn't it just a matter of drawing up the solution and injecting it? Or is there more to it than that?
Well, yes, there is actually a lot more to it. Firstly, it's a procedure which isn't completely devoid of risk because you have to inject a medication into the back of the eye. The medication needs to be sterilely prepared and manipulated with care. But you've also got to realize that there can be interactions with the medication and the syringe which is used. And these interactions can cause a certain amount of compounds, in this case silicone oil, which can migrate from the syringes which are used. In this case, the silicone oil is used as a lubricant. And what happens is that this silicone oil can accumulate, especially if the patient has numerous injections. It can accumulate into the back of the eye, and it has been shown that it can cause reduced visual acuity, endophthalmitis, or, for example, a reversible rise of intraocular pressure. It's also been noted that certain patients have this impression that they have like floaters uh, impacting their vision to a certain extent. It's a medical procedure which can be risky because we are injecting a medication into the back of the eye, so it's not always that straightforward. But you've also got to take into account the fact that there are several types of medications which can be injected, and these medications all have more or less different physical chemical properties. And some of them can interact with the syringe, which is used in the medical procedure.
Hmm. Of course, bevacizumab is a monoclonal antibody. Is there any problem with aggregation of the drug?
What's interesting here is that bevacizumab, which is an antivascular endothelial growth factor, normally used as a chemotherapy agent, for the treatment, for example, of age-related macular degeneration, can reduce the impact of the disease, really make it less pregnant. But unfortunately, it's also the actual composition of the drug, notably in this case the excipients, which have this tendency to extract the silicone oil from the syringe. And once the silicone oil is extracted, as we said, it can end up in the patient's eye, but it can also cause an aggregation of the antibody, which will interact on the water-oil interface of these little oil droplets, these little silicone oil droplets in the medication which is being injected.
Mm-hmm. And is this a problem for the patient? I mean, can they see the particles?
The patients shouldn't be able to see the bevacizumab particles because they, thank goodness, are subvisible particles. But the problem we have here is that when this antibody, because bevacizumab is a monoclonal antibody, when it aggregates, which means that several of these molecules all come together at the surface of the silicone oil droplet, it can induce potentially modifications of its structure and therefore of its potency.